Welcome back to our channel. Today we're diving into some of the most crucial internal medicine secrets that every healthcare professional should know. These are those high-yield facts that can really make a difference in your clinical practice. We'll break down complex concepts into easy-to-understand explanations and give you practical takeaways. Let's get started. Alright, let's talk about bilateral pleural effusions. Now, when you see this on a chest X-ray, your mind should immediately jump to congestive heart failure. Why? Well, when the heart isn't pumping efficiently, it can lead to a buildup of pressure in the blood vessels of the lungs. This increased pressure pushes fluid out of the blood vessels and into the pleural space, which is the space between the lungs and the chest wall. And here's the thing, guys, bilateral pleural effusions are a classic sign of CHF. Recognizing this pattern early on can be crucial for timely diagnosis and management. So if you see bilateral pleural effusions, don't hesitate to investigate for heart failure. Now, let's talk about a condition that often flies under the radar, adult Still's disease. It's a rare inflammatory disorder that can present with a whole bunch of non-specific symptoms, like high spiking fevers, rash, and joint pain. And because these symptoms can mimic so many other conditions, it can be really tricky to diagnose. Here's the thing. Early diagnosis of adult Still's disease is important because it can lead to long-term complications if left untreated. So, if you have a patient with persistent fever, rash, and joint pain, especially if other potential causes have been ruled out, keep adult Still's disease on your radar. Now let's talk about blood clots, specifically venous thromboembolism or VTEL. If a patient comes in with an unprovoked VTEL, meaning there's no obvious trigger like recent surgery or prolonged immobility, it's crucial to think about the possibility of an underlying clotting disorder. That's where thrombophilia testing comes in. This testing looks for inherited or acquired conditions that make the blood more likely to clot. And here's why it's so important. Identifying a thrombophilia can significantly impact management. Patients with these conditions might need long-term blood thinners to prevent future clots. So, if you see a patient with recurrent VTL or a strong family history of clotting disorders, don't hesitate to order thrombophilia testing. Let's face it, knee pain is incredibly common, especially as we get older. And when it comes to osteoarthritis, finding effective pain relief is key. Now, while oral pain relievers can be helpful, they often come with a long list of potential side effects. That's where topical NSAIDs come in. These are non-steroidal anti-inflammatory drugs that are applied directly to the skin over the affected joint. And guess what? They can be surprisingly effective. Studies have shown that topical NSAIDs can provide significant pain relief in knee osteoarthritis, often comparable to oral NSAIDs but with fewer systemic side effects. So, if your patient is struggling with knee osteoarthritis pain, consider giving topical NSAIDs a try. Now let's talk about kidney function, specifically creatinine and BUN levels. Creatinine is a waste product that's filtered out of the blood by the kidneys. And when the kidneys aren't working properly, creatinine levels in the blood can rise. Now it's tempting to assume that any increase in creatinine means a decrease in glomerular filtration rate or GFR, which is a measure of how well the kidneys are filtering waste. But here's the catch: creatinine levels can also be affected by other factors, like dehydration or muscle breakdown. That's why it's crucial to look at the BUN or blood urea nitrogen level as well. BUN is another waste product that's filtered by the kidneys. If both creatinine and BUN are elevated, it's a much stronger indicator of true kidney dysfunction. Okay, let's talk about kidney stones, specifically recurrent kidney stones. If a patient has had more than one kidney stone, it's not enough to just treat the current stone and send them on their way. We need to dig deeper and figure out why they're forming stones in the first place. That's where a metabolic evaluation comes in. This involves a series of blood and urine tests to identify any underlying metabolic abnormalities that could be contributing to stone formation. Things like high calcium levels, low citrate levels, or acidic urine can all increase the risk of kidney stones. Statins are incredibly effective at lowering cholesterol and reducing the risk of heart disease. But one of the most common side effects is muscle aches or myalgias. Now, while it's important to take muscle aches seriously, it's also important to remember that not all muscle pain in people taking statins is actually caused by the statin itself. So, before you discontinue a statin due to muscle aches, there are a few things you should do. First, check vitamin D levels. Calcium, phosphate, and magnesium, as low vitamin D can contribute to muscle pain. Also, check TSH levels to rule out hypothyroidism, another potential culprit for muscle aches. Alright, let's talk about thyroid scans, specifically radioiodine uptake scans. These scans are used to evaluate thyroid function and look for nodules. Now, typically, a normal thyroid gland will take up a certain amount of radioactive iodine, but in some cases, you might see decreased or absent radioiodine uptake. And when this happens, there are two major things to consider: destructive thyroiditis and exogenous thyroid hormone use. Destructive thyroiditis is a condition where the thyroid gland is inflamed and leaking thyroid hormone. And exogenous thyroid hormone use, like taking levothyroxine, can suppress the thyroid gland's natural production of thyroid hormone. Now let's talk about candidemia, which is a bloodstream infection with candida, a type of fungus. It's a serious condition that requires prompt treatment. But here's something that often gets overlooked. Candida can spread to the eyes and cause a condition called endogenous fungal endophthalmitis. Endogenous fungal endophthalmitis is a serious eye infection that can lead to vision loss if not treated quickly. So if you have a patient with candidemia, it's absolutely crucial to get an ophthalmologic examination. An ophthalmologist can look for signs of infection in the eye, such as vitreous abscesses, or those characteristic fluff balls in the vitreous humor, which is the gel-like substance that fills the eye. Alright, let's finish strong with a quick but important one. When you're looking at an abdominal ultrasound, pay close attention to the size of the kidneys. Now, if you see a unilateral small kidney, meaning one kidney is significantly smaller than the other, it should raise a red flag for renal artery stenosis. Renal artery stenosis is a narrowing of the artery that supplies blood to the kidney, and when blood flow to the kidney is restricted, it can cause the kidney to shrink. So if you see a unilateral small kidney on ultrasound, especially if it's less than 9 centimeters in size, it's crucial to consider renal artery stenosis as a possible diagnosis and order further imaging studies to confirm the diagnosis. Thanks for watching. If you found these internal medicine secrets helpful, don't forget to like, subscribe, and hit the notification bell for more medical insights. Remember, staying up to date on the latest medical knowledge is crucial for providing the best possible care to your patients. These insights are just a starting point. Always consult the latest research and guidelines to stay current in your practice. See you next time.